name is Lindsay Tillis. I'm a nurse practitioner student at Auburn University, and I'll be doing a head-to-toe assessment today on my patient. So first I would walk in, I would do hand hygiene. We've already done the vitals for this patient: heart, blood pressure, or heart rate, blood pressure, respirations, BMI, everything was in normal range. So first I would come in and introduce myself. Hi, my name is Lindsay. You're a nurse practitioner student today. And we would start with the skin. So I'm going to look throughout the skin, feel of the skin. There's no crepitus noted, no swelling, no edema. Look at the nails. Capillary refills less than 3 seconds. There's no clubbing. Look throughout. I don't find any edema. Skin is warm throughout. So then I would move to the head, palpate the head, look for any sort of masses or deviations. It is symmetrical. And hair is fine. There's no infestations seen. There is some facial hair. From there, we would move on to the eyes. So I'm going to look at your eyes. They're symmetrical. Your eyebrows, eyelashes, and everything are present and symmetrical as well. I'm going to look at, get you to remove your glasses. I'm going to look at the conjunctiva. It's pink and moist. Sclera is white. The iris and color of eyes are all normal. I'm going to feel for your maxillary and temporal sinuses. Is there any pressure there? No? Alright, so now I'm going to look at the eyes. I'm going to get you to stare straight for me. And when visualizing the eyes, so first I noticed the red reflex is present. I did see the vessels were no nicking of the vessels. The optic disc was seen. There was no other masses or deformities noted. I would do this bilaterally, but for today we're just going to do one side. So now I'm going to move on to your nose. I'm going to look for any sort of deviations in the septum, which there is none. There's no mucus noted. And I'm going to get you to sniff in on both sides. Alright, and the nares are patent. I'm going to get you to open your mouth. Say ah. Alright, lift your tongue up. Alright, all the mucous membranes are pink and moist. There's no abnormalities to the soft or hard palate. All teeth are intact. And there's a few cavities, but overall good oral hygiene. So now we're going to move to the ears. I'm going to palpate outside the ears. Lift the pinna. Is there any tenderness there? Okay. So now we're going to do our internal ear exam. Alright, going to look in. The ear canal was clear. There's no earwax present. I did notice the cone of light. And the tympanic membrane's pearly gray color. I would do these bilaterally, but today we're just going to do one side. So from the ears, I'm going to palpate for the neck. I'm going to look for any sort of masses. The trachea is midline. I'm going to come around and check for thyroid and get you to swallow. Alright, and I was unable to feel, so the thyroid is in normal finding. So from there, I'm going to check the lymph nodes, so submandibular, submental, preauricular, postauricular, occipital, the anterior cervical chain, and the posterior cervical chain, and the supraclavicular. No lymph nodes are palpated on that. So I'm going to do the cranial nerves now. So first the cranial nerve number 1, I'm going to do the olfactory nerve. So I'm going to get you to close your eyes and tell me what you smell.
Alcohol.
Alright, good. So cranial nerve 1 is intact. So now I'm going to do cranial nerve number 2. I'm going to get you to cover one eye and read the lowest line possible.
8FD 2B7.
Alright, and do the other side.
8FD 2B7.
Alright, so that is a 20/20 vision. and I would hold this 14 centimeters in front of the patient to have that accurately read. So that was an optic nerve vision test. So also I'm going to check for peripheral vision. So I'm going to get you to close one eye and tell me when you see my fingers.
No.
All right, close the other eye.
No. No.
All right. So that is optic nerve number two, cranial nerve number 2. Optic nerve is intact. So cranial nerve number 3, 4, and 6. We're going to check for the pupils. So I'm going to get you to just stare out front and for me. And then stare off and then follow my pin in. Alright, so the pupils are reactive to light and are 3 millimeters in size. And they also are accommodate appropriately. So now I'm going to get you to follow my pin light with just your eyes. In this test for the 6 ocular motor movements. So that test for cranial nerve 3, 4, and 6. So cranial nerve number 5 is the facial nerve, or the trigeminal nerve. So I'm going to check, is there any pain here? Open your mouth and close it. Alright. So I'm going to do a soft and hard touch for cranial nerve number 5. This is a sensory portion. So close your eyes and tell me if this is soft or hard.
Soft. Hard. Soft. Soft.
Okay. So cranial nerve 5 is intact. Cranial nerve 6, the facial nerve. So I'm going to get you to smile, frown, puff out your cheeks, raise your eyebrows. All right. So cranial nerve 7, facial nerve's intact. The sensory portion, we would do a taste test, but we're going to skip that today. Cranial nerve 8, the acoustic nerve. So I'm going to do a whisper test. Tell me when you can, or tell me what you can hear.
Dog house.
Correct. I'm going to stand on this side.
Dog house.
My patient does have some sort of hearing deficit, but that is a cranial nerve, acoustic nerve testing. So now we would move on to cranial nerve 9 and 10. So we're going to look at your mouth. All right, and say ah.
Ah.
All right, uvula rises, and the voice is appropriate. There's no hoarseness noted. Going back to my cranial nerve, acoustic nerve, we're going to go ahead and do this sort of hearing test as well as the Weber and Renan test. So when I palpate, or when I put this on your head, you're going to tell me if you can hear it bilaterally. That would test for lateralization of hearing.
Yes.
Okay, so now I'm going to put it behind your ear. Tell me when you can stop hearing the vibrations. All right, that's a correct finding. Air conduction was greater than bone conduction, and that was a Renan test. So back to the spinal accessory nerve, cranial nerve number 11, where I'm going to get you to raise your shoulders against me pushing and push your face against mine, and on the other side. All right, so that's a normal cranial nerve 11. Cranial nerve 12, we're going to also look at your mouth. We're going to get your tongue to go up and down. And against your side of your mouth, like this. Push it against, okay. And the other side. All right, so there's no deviations there. So cranial nerve 12 is intact. So now we're going to move on to the respiratory portion. We already completed the neck. So I'm going to feel for any lifts or heaves. None are noted, so I'm going to go ahead and also check for the respiratory expansion. So take a deep breath in. All right, that's symmetrical. There's no use of accessory muscles. And now I'm going to auscultate. Deep breath in. In, out, in, out, in, out, in, out, in, out. All right. Nose clear. Breath sounds noted throughout, no crackles or wheezes. We'll listen here and out. Alright, so that was a normal finding. So now I'm going to percuss. Alright, and there was resonance heard throughout. So now I'm going to percuss for diaphragmatic excursion. So take a deep breath in for me and hold it. Alright, let it out, and deep breath in and let it out. Alright. So that is 7 centimeters, and that's a normal finding. Now I'm going to check for tactile firmness. Get your repeat 99.
99.
99.
99.
99. Alright. And same for this, 99. Alright. So that's a normal finding. Now I'm going to move to cardiac. We're going to palpate for lifts and heaves as well. None were felt. I'm going to listen to my patient sitting up and then laying down. So I'm going to listen to the apical, and then pulmonic, Erb's point, tricuspid, and mitral valves. Alright, I'm also going to listen with my bell for any breweries or abnormal heart sounds. Alright, none were noted. I'm also going to feel at the apical pulse to feel for that. Alright, and that is good, a normal finding. Sometimes you can't feel these in patients. So I'm going to get you to lay down, and I'm going to listen. Heart sounds can be different when laying down than sitting up. So you want to do a correct listen of all the heart sounds. So same areas. Alright, listen to my bell. Alright, now I'm going to visualize the jugular vein, so I'm going to get you to turn that way a little bit. You should be able to see some sort of pulsation, but when the patient lays down, you want to make sure that it doesn't enlarge or have any abnormalities to that. So that's fine. While we're here, I'm going to also go ahead and listen to my carotid. You can turn your head forward now. Listen for any breweries or... Alright, none were noted. So that's a normal finding. So now I'm going to get you to sit up. And I'm going to check your pulses. So we're going to check your radial, brachial, check your carotids. And you would only do this one at a time, so the patient wouldn't stop breathing. Check your femoral pulses, popliteal, posterior tibial, and dorsalis pedis. All of these are +2, felt without. So now moving on from the cardiac, I'm going to get you to lay back down. We're going to inspect the stomach. Get you to pull your shirt up just a little bit. So we're looking for any masses, any deviations, any obtundedness or ascites. Patient is normal. So now we're going to listen in all 4 quadrants. All right, and all bowel sounds are no more active. There was no hyperactive or hypoactive. Now we're going to listen with our for any sort of breweries abnormalities listen within. Going to do the apical and the femorals. No hernias are noted or felt. Now we're going to percuss. All right, now we're going to percuss the liver size. All right, and measure that is 7 centimeters, so that is a normal finding. Now we're going to palpate for the liver. You should not be able to palpate. Also for the spleen, that would be an abnormal finding for any liver or spleen enlargement. So now we're going to palpate, soft palpation for any sort of tenderness, rebound tenderness. Deep palpation, you got to go a little bit deeper. There's no masses felt. So now, also going to do the test for the reflex, and that is a normal finding. The stomach does move. So I'm going to get you to sit back up for me. Alright, so then we're going to do musculoskeletal. So I'm going to check all your joints, feel them, any tenderness. Check your shoulders. Any swelling or tenderness there, none is noted. No tenderness here. Alright, and we're going to look at your hips, make sure those are normal. Feel if any tenderness or crepitus in the knees or in the ankles. None are noted, no edema noted. So I'm going to check your grips, and that would be a 5 out of 5. I'm going to get you to resist me pulling on you. Resist me pulling on you. All right, good. So now we're going to move your wrist and your feet. Put your arms behind you, above your head. Bend side to side. All right, now stand up and move your knees like this. Flex your hips, all right? And no tenderness, anything there. Okay, so you can go ahead and sit down. Now I'm going to check your, well, we can check your reflexes at the end. So musculoskeletal is complete, so we're going to move on to neuro. Any sort of, with these you would want to check alert and oriented. So do you know where we're at today, sir?
Yeah.
Where?
Mobile.
Okay, Mobile. What's your birthday?
September 27th.
All right, and what year did you graduate high school?
2000.
Okay, so then from there, I'm going to get you to remember 3 items. So red apple, blue boat, and a yellow balloon, or yellow banana. And I'm going to get these to be recalled at the very end of the assessment. So that would check remote memory. So with any sort of sensory of a neuro assessment, so I'm going to get you to close your eyes and tell me what this is.
A pen.
And checking for graphesio, I'm going to get you to tell me what letter I write.
A.
Correct. All right, so then also with that, I'm going to check your any sort of sensory throughout, if it's soft or hard. I'm going to get you to close your eyes. Tell me if it's soft or hard.
Hard. Soft. Hard. Soft. Hard. Soft. 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 Hard. Soft. Soft.
All right, and that's a normal finding. So the motor portion, I'm going to get you to stand up, and I'm going to get you to put your finger to your nose into my hand. All right, and the other side. All right, so then I'm going to get you to move your foot down, and on the other side. All right, I'm going to get you to stand back here and walk to the front of the bed, heel, toe. All right, and then walk back on your tippy toes. Okay, Good. So come stand back out here. That's a normal finding. So now we're going to do cerebellar function. So testing for the Romberg test. So I'm going to get you to close your eyes and put your arms out and stand on one foot. Okay. So then I'm also going to check your spine. So I'm going to get you to turn around. No deviations in the spine. So no scoliosis noted. I'm going to get you to turn your spine left and right. Go down, touch your toes. Any abnormalities, tenderness, pain there? Okay. All right, so now we're going to check our reflexes. You can go ahead and sit down. All right, so radialis, brachioradialis, the bicep. All right, now rest your arm. All right, and the bicep, tricep, reflex. Okay, and now we're gonna check your ankle. All right, and then the Babinski reflex. So if your feet curl upward, that's a positive finding. You would see that only in children, and as adults, you would want to see your toes flared down. So to finish my neuro assessment, I'm going to get you to recall those 3 things I asked you to remember.
Red apple, blue oat, and yellow banana.
Correct. And so his remote memory is intact. And you would also do your cranial nerves for this part of the session, but I already did that in the beginning. And I think that would complete my head to toe assessment. Thank you for watching.